Hi everyone, my name is Lauren and I live with schizoaffective disorder, and today I'm going to be answering some of the most Googled questions about schizophrenia. But first, if you want to see more videos like this one, make sure to subscribe to our channel, and if you want to help support the creation of future videos like this, make sure to check out the link to our Patreon page in the description below. Okay, so I'm going to be taking you through the top 12 most Googled questions about schizophrenia. So the first question is, what famous person has schizophrenia? So there aren't a lot of well-known famous people today who have schizophrenia or that we know of who have schizophrenia. And I think this might have to do with stigma, just people not willing to disclose that they have this illness. Because I would imagine that at least a few people have it who are currently famous. For example, Lady Gaga just came out and talked about her most recent psychotic episode on Oprah. Now, she hasn't publicly said that she's diagnosed with schizophrenia, and I don't think she has been. But for example, there are celebrities who experience psychotic symptoms. So there probably are more than we actually know about. But for now, I'm just going to give a brief list of the people who we've known have schizophrenia. So there is John Nash, who the movie A Beautiful Mind was centered around. He's a famous mathematician. There's also Edward Einstein, who is one of Einstein's sons. There is Zelda Fitzgerald, who is F. Scott Fitzgerald's wife, the famous American author who wrote The Great Gatsby. Jack Kerouac is another American author who has schizophrenia. He wrote On the Road. And then there's also Vincent van Gogh, who a lot of psychiatrists today believe he had schizophrenia. There are also a couple of well-known musicians who have schizophrenia. So there's Peter Green, who is a guitarist and a founder of Fleetwood Mac. And then there is also Brian Wilson, who is a member of the Beach Boys. They both have schizophrenia as well. And this is kind of a general list of the most well-known people that we know of who have schizophrenia. But like I said earlier, there are probably more well-known people who have it and just haven't come forward with it due to the issues like stigma. Do people with schizophrenia know that they have it? Okay, so for the most part, I think that people who are living with schizophrenia do know and understand that they have been given that diagnosis, and they can understand that and know that they have it because they've hopefully talked about it with their doctor. But some instances where this might not be the case, where they might not actually be able to understand or know that they have it, is when there's a lack of insight or when anosognosia is at play. Now, I did a video on what anosognosia is, so if you want, you can check that out. But basically, anosognosia is when an individual can't really understand or grasp their mental illness or the fact that they have their mental illness. And it's actually the reason why a lot of people with bipolar disorder or schizophrenia don't take their medications. So I myself have gone through periods of lesser insight or anosognosia where I didn't really believe that I have schizoaffective disorder. And I couldn't really understand what that meant in the context of how my symptoms were affecting my life or that kind of thing. And it was really hard to really understand the effect that my mental illness was having on my life. And so that's kind of just an example of when an individual can be experiencing anosognosia. Does schizophrenia worsen with age? So I think it's important to note that with each psychotic episode an individual has, the worse the symptoms really tend to kind of flare up going forward. So in that regard, if it's left untreated, it could potentially be worse the more frequently somebody has psychotic episodes, and I guess the older they get. But there's an excerpt that I want to read to you from the book Surviving Schizophrenia, a family manual. It's a really great book if you want to check it out for anything else too, but I'm just going to read you one excerpt on getting older with schizophrenia. So they say, it has been clearly established in recent years that the 30-year course of schizophrenia is more favorable for the average patient than the 10-year course. This directly contradicts a widespread stereotype about the disease that dates to Kraepelin's pessimistic belief that most patients slowly deteriorate. A major reason for this better long-term prognosis is that aging ameliorates the symptoms of schizophrenia in most people. Symptoms of this disease tend to be most severe when the person is in his or her 20s and 30s, then become somewhat less severe in the 40s, and significantly less severe in the 50s and 60s. We do not understand why this is so, and there are, of course, many exceptions, but schizophrenia represents one of the few conditions in life for which aging is an advantage. So I kind of actually believed the commonly held misconception that schizophrenia prognosis gets worse with age, but this is saying that that's actually not the case, and that studies have shown that it's actually the opposite, where aging really helps with the symptoms of schizophrenia. Can schizophrenia go away? So with proper medication and proper treatment, the symptoms of schizophrenia can be greatly lessened or maybe even in some cases go away seemingly. But it's important to note that there is no cure for schizophrenia. And so no, schizophrenia can't really go away. However, like I said, the symptoms can be managed effectively. Can schizophrenics love? Yes, of course, people who are living with schizophrenia are capable of love. They're capable of the full range of human emotion, just like anyone else. It is true that some people who are living with schizophrenia may have a harder time managing relationships and that kind of thing, but they are totally capable of loving, and I can speak from experience that I myself am capable of loving. So yes, people who are living with schizophrenia can love. Is schizophrenia inherited from the mother or the father? So it's possible to inherit schizophrenia from either your mother or your father, or both. But the chances of inheriting it when your mother has it are 9.3%, and the chances of inheriting it when your father has it are 7.2%. So there is a little bit of a discrepancy there in terms of having a little bit more of a higher percentage of risk if your mother has it, but for the most part, it's pretty even and you can inherit it from either parent. How do you test for schizophrenia? So there's currently research being done into looking into biological markers for the illness, but as it stands right now, basically what happens is your doctor or psychiatrist examines the presenting symptoms and makes a diagnosis based off of that. Now, to rule out any physical illnesses, they may perform some diagnostic tests such as MRIs or CT scans or that kind of thing, just to rule out any physical ailment or physical illness that might be contributing to the symptoms that you're experiencing that might look like schizophrenia. But there are no specific laboratory tests or diagnostic tests right now as it stands for schizophrenia. Are schizophrenics smart? Yes, we are all geniuses. Next question. Just kidding. No, people who with schizophrenia are not more intelligent than anyone else. It affects everyone equally, and so there are going to be people with schizophrenia who are more intelligent than the average person, but there are also going to be people with schizophrenia who are less intelligent than the average person. And there's a whole spectrum of intelligence levels that people are going to have when they're living with schizophrenia, just like the average population. I think that a bit of a negative stereotype is that people with schizophrenia are geniuses of some kind, and I think this is really a prominent belief because of stories like A Beautiful Mind of John Nash, who is a genius in terms of mathematics, but I don't think that that's representative of most people who are living with the illness. Just like the general population, most people aren't geniuses, but some people are, and so you're going to have that same sort of reflection in the population of people who have schizophrenia. What triggers schizophrenia? So there are several factors that contribute to the risk of developing schizophrenia, and these include genetics, environment, brain chemistry, brain structure, and brain development. So scientists believe that many different genes may increase the risk of developing schizophrenia, but there is no one gene that's responsible for the development of schizophrenia itself. And it is not yet possible to use genetic information to predict who is going to develop schizophrenia. Scientists also think that interactions between an individual's genes and an individual's environment are really pivotal in terms of the development of schizophrenia. So the person's environment plays a really big role in terms of triggering schizophrenia. How do you help someone with schizophrenia? So we already did a video on how to support someone with schizophrenia or schizoaffective disorder. So make sure to check that video out if you want to learn more. But I think at the core of it is really to just be there for the person and to show them love and compassion. Some more guiding points though on how to actually do this though for the person are to accept their illness and any of the difficulties that it poses as well. Also to not buy into the myth that somebody who's living with schizophrenia can't get better or can't live a meaningful and productive life. Do your best to help your loved one to feel better and enjoy life, but also make sure to still pay attention to your own needs and to make sure you're looking after yourself as well. And I think the last quick point would just to be to maintain a sense of humor through it all and to maintain a sense of hope too. I think from my experience, doing all these things really helped in terms of my loved ones supporting me through the illness and helping me to come to terms with my schizophrenia or schizoaffective disorder. But I think, again, what's really at the core of it and what really helped me the most was my friends and family just showing me love and showing me that they still loved and cared for me even with the illness. And they just accepted every part of me in that way. Is there a genetic test for schizophrenia? So there is no current genetic testing to predict somebody who's going to develop schizophrenia as it stands, but researchers are working on this right now. It's also important to note, though, that it is a combination of genetics as well as environmental factors that are kind of at play in terms of determining who develops schizophrenia. So it's not just about the genetic predisposition, but it's also about the environmental factors. But as it stands, there are no current genetic testing to determine who has schizophrenia or who will develop schizophrenia. What does schizophrenia do to the brain? In schizophrenia, dopamine is tied to hallucinations and delusions, and so brain areas that run on dopamine may become overactive. And antipsychotic medication actually stops this from happening or prevents it from being too overactive. So scientists are working right now to understand more about what actually happens in the brain when schizophrenia is present. Doctors also believe that the brain loses tissue over time, and imaging scans such as PET scans or MRIs show that there is generally a loss of gray matter over time. So this increased knowledge about how the brain structure is actually affected with schizophrenia is leading some people to call for a change in the way that schizophrenia is identified. So not as a mental illness anymore, but more as a brain disease like Alzheimer's or things like that. Is schizophrenia a chemical imbalance? Schizophrenia is caused by a chemical imbalance of things like dopamine, like I mentioned in the previous question, as well as other changes in the brain. So like I mentioned in the previous question again, the brain structure actually changes as well. So I hope that helped to shed some light on some of the most commonly Googled questions. I think they were great questions, but some of them I was a little surprised by. I was surprised that people were Googling them and wanting to know the answers to them, but I think that that just alludes to the fact that there is so much unknown around schizophrenia and around the illness and around what people know. And I think a lot of this has to do with stigma around the illness. People just don't know very much about it. So I hope this kind of helped to shed some light on some of those questions and hope you enjoyed it. If you'd like to see more videos like this one, make sure to subscribe to our channel. And if you want to help support the creation of future videos like this one, make sure to check out the link to our Patreon page in the description below. Thanks so much again for watching and wishing you and your loved ones good health. Bye.